Hello everybody. Today we are going to study about the role of ultrasound in medical diagnostic imaging. Sonography, also called the ultrasound imaging, plays a vital role in the modern healthcare system. Firstly, it is a non-invasive diagnostic tool. Remember in the last lecture we talked about a lot that ultrasound only uses high frequency sound waves for the imaging of the internal body structures like the organs of the body, liver, gallbladder, pancreas, kidneys, urine bladder, female reproductive organs like uterus, ovaries, and so many other structures. It also helps us visualizing the vessels of the body throughout the body. Also, we study about the internal anatomy and the internal blood flow of the heart and so many other things that we can study through ultrasound. This helps the health professionals to identify the abnormalities like tumors, cysts, and the other abnormalities. The second important role of ultrasound or the advantage of using ultrasound is that it do not involve the use of ionizing radiations like in X-ray or like in CT scan, or even it does not involve the use of magnetic radiations like in MRI. It is much more cost-effective imaging modality as compared to other imaging modalities. So it can be used by a wide range of patients. It is portable and it can be used in outpatient clinics. So there is no need of hospitalization once again reducing the cost. The report of the ultrasound, the patient gets the report of the ultrasound instantaneously as compared to the other modalities where it takes about 2 to 3 days to get the report. In the following slides, we will study about the role and its impact on the patient care. First, the diagnosis of pregnancy. Pregnancy can be confirmed on ultrasound as early as 4 weeks. Now, this is just the time the female came to know that she has missed her menstrual period. So, for in this case, the ultrasound will be considered as first modality of choice because normally, if you see here, this gray structure is uterus, and this thin, wide, bright, linear structure is called the endometrial cavity or the uterine cavity. Now, if it looks like this, that means it is empty. We can say right now that it's empty and there is no gestational sac. Gestational sac is the structure which will confirm the pregnancy. So whenever there is pregnancy, you can see in this image that there is a black structure which is embedded in the endometrial cavity, and it is surrounded by thin, bright, rather thick, bright layers surrounding this black area. And this is the typical appearance of gestational sac. So whenever we see this type of structure within the endometrial cavity, we can confirm that the patient is pregnant. So There are only three ways to confirm pregnancy. Number one is a urine test for pregnancy that can be easily done at home or in outpatient clinic. But the problem is that it is not a reliable test. There are so many conditions in which it will be seen as false positive, means there will be no pregnancy, but it will be showing pregnancy. And there will be so many cases in which the urine pregnancy test will show false negative, means no there will be pregnancy, but the urine test kit will show no pregnancy. So that is not reliable. The second way we can confirm the presence of pregnancy is a blood test which is called beta HCG. HCG stands for human chorionic gonadotropin hormone. It is a very highly specific and accurate test for confirmation of pregnancy, no doubt about it. If performed correctly, definitely. And if it is positive, it means the patient is pregnant. And if it is negative, that means the patient is not pregnant. So there are no false positive or false negative results in this case. But in this case, definitely, as I told you that it is a blood test, so we have to draw the blood of the patient, number one. But more importantly, the report, if this blood test is done in outpatient clinic, will be given in 24 to 48 hours, means it will take about 1 to 2 days for the patient to get result. And also, if sent in external laboratory, then it will take several days. So this is not the only difference or advantage between the beta HCG and ultrasound imaging for confirmation of pregnancy. But once the pregnancy is confirmed, the doctor or healthcare personnel or gynecologist wants to know that, okay, pregnancy is there, but is embryo is there, means fetus is there, number one. Number two, what is the gestational age of the fetus, means it is 4 weeks, 5 weeks, 6 weeks, 7 weeks. Number two. Number three, what did you see the embryo, means the fetus? If you see the fetus, what is the did you see the fetal heart motion within the embryo? And if you see the embryo, then what is the embryo together with fetal heart motion? Then what is the fetal heart rate? So all these 3, 4, 5 questions, including presence of or absence of embryo, presence or absence of fetal heart motion, what is the fetal heart rate, what is the gestational age? These all answers cannot be, these all questions cannot be answered by blood test beta HCG. These can only be answered by ultrasound on a single scan image. So you can see in this image, there is a very small embryo. This echogenic structure is embryo within this gestational sac. And if you see, there is a very little flicker of heart motion, you can easily see. On live, I think I can see it also, but it takes a little while for the eyes to be used to it, of seeing it. There are other mode imaging, like we have studied in previous lectures, that M mode will be the mode that will now determine, if you cannot see it through naked eyes, then M mode will be the mode that will be utilized in this to see the presence of the fetal heart motion, as well as it will tell us the fetal heart rate. So The main thing that we learned through this slide is that how much important role the ultrasound play in confirmation of pregnancy. Diagnosis of ectopic pregnancy. So what is ectopic pregnancy? Ectopic pregnancy means any pregnancy outside the endometrial cavity. So it may be in the myometrium, it can be mostly in the fallopian tubes. 99% of the ectopic pregnancy are in the fallopian tubes, which are the tubular structures surrounding on either side of the uterine fundus. So, if not diagnosed, then early, say for example, 7 to 8 weeks, because as I told you that in 99% of the cases, the ectopic pregnancy occurs within the tubular structure, which are called fallopian tubes. So when the fetus baby starts growing from 4 weeks to 5 weeks to 6 weeks, 7 weeks, 8 weeks at approximately, so they are growing, the sac is growing, the fetus is growing, so that tubular structure cannot hold it for a longer time. That tube will rupture. This is called ruptured ectopic pregnancy. So when it occurs that the tube is ruptured, there will be internal bleeding occurring within the body, and that will suddenly lead the patient to hypovolemic shock. So once again, you can see how important is ultrasound for the diagnosis of the ectopic pregnancy. There are other modalities like MRI, but once again, magnetic radiation to the patient as well as to the fetus. So very costly, it will take to issue the report. One other procedure is laparoscopy, which is a surgical procedure in which we put a tube with a camera and see the internal structures. So ultrasound is the first and the best choice to rule out or to include the ectopic pregnancy. And as I told you, it won't take more time to get ruptured than which is a severe life-threatening emergency, and the patient might be lost. Twin pregnancy, for example, because there is a lot of difference between the management of single pregnancy and the pregnancy, which is twin pregnancy, throughout the term up to 40 weeks. So, if we will tell the doctor that it's a twin pregnancy, then she will manage it accordingly. So that can be easily identified on ultrasound by looking at two gestational sac, and these gestational sac will have their own embryo and their own yolk sac, and the whole baby will be in different sac. So not only this that we can tell by looking at two gestational sac that it's a twin pregnancy, but there are 3 types of twin pregnancies. We can also diagnose them and let the doctor know, because one of them is a little bit more safer than the other two, and then one is very dangerous. So it helps a lot. So twin pregnancy, anencephaly. Anencephaly means the absence of skull or brain tissue. Now, look, when there is no bony skull around the fetal head, and normally 80-90% of the main brain, that is cerebral hemisphere, is also not present. Only a part of the brain in the cerebellum and midbrain are only present. So as soon as the baby will be delivered, or after birth, you can say, the baby cannot survive. So skull is usually formed and can easily be identified on ultrasound at approximately 10 to 12 weeks of gestational age. So usually there is a routine ultrasound in second trimester for the diagnosis of these different congenital abnormalities. So if after first trimester, that is after 12 weeks, say for example, or 13, 14, 15 weeks, we can easily see this abnormality and then we will report it. The doctor will ask the patient about this baby because she knows it, that this baby cannot live after birth, and convince the patient. And the patient will abort this sort of congenital abnormality, the fetus having this congenital abnormality. So look how much important is this, that if at 13, 14, 15 weeks, this fetus is, any fetus is diagnosed with anencephaly and is being aborted, then the mother will not remain under physical or mental stress for the next 25 to 30 weeks, means till term. Otherwise, if not diagnosed by ultrasound, then the mother might have gone till 40 weeks and the result will be nowhere, because such fetuses do not survive. So once again, you can see the importance of ultrasound through congenital abnormalities. Placenta previa. Placenta is the structure where this fetus and maternal blood come in exchange. It is a highly vascular structure. All the gaseous exchange means oxygen-rich blood and nutrition-filled blood from the mother will come to the baby, and the deoxygenated blood from the baby will go to the mother. So exchange of gases. It is highly vascularized. Now, if it is placenta previa, what is placenta previa? Just for the sake of the example, normally this is cervix, and you can see two cursors. One cursor which is seen at the top and one is at the bottom. This is cervical canal, and this small opening at the top of the cervix is called internal os, and this on the outside is called external os. Now, if placenta will reaches to this internal os, or it will cover this whole internal os, this is called placenta previa. Now, if the patient didn't go under ultrasound study, and if the gynecologist try to deliver this fetus normally, means through gyn, then when the fetus will pass through this to come out, it will pass through this placental structure, which will definitely rupture and will lead to severe bleeding that can lead once again to hypovolemic shock, and not only the baby will be in danger, but rather the mother will also be in danger. So both lives will be in danger. But when the ultrasound, routine ultrasound, we do 3 ultrasounds in 40 weeks. So during these ultrasounds, we see that this placenta is covering the internal os, and we diagnose it as placenta previa. The doctor will never ever try to deliver it normally. Then they will go for the operation called cesarean section. So without ultrasound, you can see that how dangerous it is. Cervical incompetence. This is also a very good example to understand the important role of ultrasound in ops especially. So what is an incompetent cervix? In an incompetent cervix is the cervix where the muscles are relaxing, they are not strong. And more importantly, the length of the cervix. As in the previous image, I told you that this is the cursor at the top is internal os, and this is on the outside is external os, and from internal os to external os is the cervix, the lower part of the uterus. If we measure this, and if it measures less than 25 millimeter, or you can say 2.5 centimeter, then what happens that after approximately 14, 15, 16 weeks, the cervix is too short that it cannot hold the weight of the baby, and that will result in opening of the internal os because of the pressure the fetus is putting on this cervical canal. And once the internal os is open, then within a couple of weeks, this whole cervical canal will open, and then the baby will be aborted or expelled out. So there is no way, if once internal os is open, you don't have, you can't do anything to hold the baby. Then it will be just a matter of time that within 2, 3, 4 weeks, the baby, the whole cervical canal will be open up and the baby will pass away, aborted. But if on ultrasound, before 13 weeks, 12 weeks, we during first trimester there is a normal routine ultrasound for diagnosing so many things. So in that first trimester ultrasound, we also measure this cervical canal. If it will measure less than 25 millimeter, we will give the diagnosis as cervical incompetence. And then when for 12 weeks, when the internal os cervical canal is not yet open, we diagnose it as cervical incompetence because of a short cervical length. Then the gynecologist or healthcare professional, whatever you want to say, they will stitch this cervical canal. Most commonly, they use short car stitch, but some other suturing also are available. Then, even if it is short, in such cases, after suturing, if it is short, then after suturing it, the internal os will not open, the cervical canal will not open, it will remain closed, and it will bear the pressure till term, and the baby might be precious, and only by doing ultrasound, we came to know that it was a case of cervical importance, cervical incompetence, and just by doing ultrasound, the doctor can save the baby by suturing the cervical canal.